This is a training review on accessing the LCH Helipad for non-transport purposes. The intended audience is marketing associates, maintenance crews working in the area, and others who need to access the pad for reasons unrelated to their direct participation in patient retrieval or transport. Security participates in patient retrieval and should do the other training module. This module must be completed with a passing score. It is required for all who will be accessing the helipad. This module is divided into 3 sections: how to access the LCH Helipad, helipad basics and safety, and the alternate landing zone. First, let's talk about accessing the helipad. Helipad access is restricted and only accessible by those with an authorized badge. After training, badge access may be granted depending on your role at LCH. The helipad is only accessible from the 2 large service elevators. Once in the elevator car, use the badge reader to scan your badge. Then press the HP button on the panel. The helipad lobby area is where you arrive when coming off the elevators. While most of the items in the lobby are related to patient care and retrieval from an aircraft, there are a few things you need to know about. It is important to remember that helicopters can be dispatched for transport at any time. This means that they can arrive to the helipad at any time. Those working on or around the helipad need to be aware of several basics about the helipad and the area around it, as well as how to assure their actions don't create hazards or impede safe operations. Hearing protection is always required when around a running aircraft. Be sure you have these in place before exiting the helipad doors if the aircraft is running. The helipad has its own automatic lighting that comes on at night. If needed, more light can be turned onto the walkway and the helipad with the red switch in the lobby. Fire suppression is important. There is a small fire extinguisher in the lobby area used for small localized fires. Think of it as a fire extinguisher you would have and use for localized fires in any area of the hospital. Next to it is a pull station that activates a foam-based fire suppression system on the pad. By the lobby stairwell door, there is a fire alarm pull which activates the fire alarm. Badge access is required to open the helipad doors. These doors should stay closed while an aircraft is landing or taking off. The helipad sits on a raised platform off the roof of the hospital. The walkway to the pad has a mildly increasing grade with a yellow safety border. The deck and the walkway is lined with a chain link netting to catch equipment or someone that could possibly fall over the edge. The walkway has wheel stops to stop anything that rolls to the edge. The fire suppression system for the helipad is a state-of-the-art foam system that sprays from nozzles located at the corners of the pad. It will saturate anything on the pad with this foam when activated to extinguish helicopter fires. The steps off the deck that are adjacent to the main helipad doors provide a route around the east side of the helipad to the northern end of the roof. The west end of the helipad has a route that leads to the roof and the maintenance floor area below. As in the helipad lobby, fire pull stations are located at the 2 exits off the helipad. These should only be pulled in the event of an actual fire, as they activate the foam system for the helipad. The fire alarm pull is in the lobby. Anytime someone is on the helipad or on the roof adjacent to it, the transfer center needs to be notified. This is to assure the dispatchers are aware of issues affecting the pad and an arriving aircraft. Aircraft can arrive quickly, and not knowing that the pad is not ready can delay and put patients and others, including you, at risk. The transfer center can be reached immediately by calling 901-287-4408. All helicopters create tremendous wind. commonly known as rotor wash, particularly during the actual lifting and landing. Part of security's job is to check for any helipad hazards, such as trash, debris, or any other objects that can be projected into the blades of the aircraft or propelled away from the aircraft by the aircraft rotor wash. Make it your job too. Work crews may leave items on and around the helipad. These objects can be picked up and blown or scattered, even striking someone on the ground below. These objects obviously need to be removed prior to aircraft arrival. Seemingly benign objects such as hats, caps, coats can become airborne and a major safety hazard. Sometimes the winds can be too great to assure a safe landing. The pilot of an aircraft may deem it necessary to land elsewhere. The loading dock area is the Lebaner alternate landing zone. It requires preparation quickly and carries additional concerns and hazards you need to know about. Landing here requires several coordinated efforts with the transfer center, the person meeting the aircraft, and security. Those working in the area have a crucial role as well. The area marked with a red H in this graphic is where the aircraft lands, though there is not an actual H painted on the ground in the dock area. The manhole covers are painted orange and are used as landmarks by the pilot to guide the aircraft in. These need to be repainted periodically. Security will work quickly to assure the area is prepared. This includes blocking the loading dock drive to traffic. Trucks and cars will need to be moved off the lot or to the far outer edge of the lot. Security will dictate this. Remember, a key point of landing in this area is the extreme rotor wash. Trash containers, particularly those with no top or cover, are a specific source of additional debris and hazard. Be sure these are closed, covered, or removed prior to landing. Ground-level helipads are particularly prone to blowing debris. Check the dock area regularly for loose trash and items that can be blown or projected as the aircraft approaches. Remember that particulate matter such as sand and dirt will be blown in a blasted fashion. For this reason, everyone should remain inside the hospital when the aircraft is landing or lifting at the dock. Only after the aircraft is landed should the doors be open. Thank you. Please be careful on the helipad and the alternate landing zone. Help us all be safe.